I think that's the only way, because you cannot, there's a time that this minister of health and social welfare tried to bring a law that you must sign this and that for what have you. I think we cannot stop it. If not even only in health sector, I don't know why we are adamant on health sector. Do you know the tech too?
The tech industry.
Do you know the bank? Is also having issue, because the fintech rather is also having issue. People are just discover that we do it better in Nigeria, and people are moving. And Nigeria are moving outside in droves, not only medical. It's only that when you have medical, we feel the gap. So I think we need to do what we're expected to do. Because if you look at those people that are working in hospital, how much is their salary? We've seen a lot of strike by health workers, not even only doctors. Because I don't like when you mention doctors. What about other health workers, nurses, pharmacists, all of them are moving in droves. So I think since we have realized this, what are government doing? I want them to have a 1 year, 2 year plan that, okay, this is what we want to do to discourage Japa. Beyond creating policy that will negate them traveling, make welfare one of the attractive things to make them to stay.
Welfare in what sense?
Right, a better salary, and beyond salary, working environment is another thing. So when we have a good working environment, salary are on time and you give them good pay. Before now they said once you get some work, you having a car, choice of a car, choice of accommodations. Those things are attractive, and it makes people, and don't blame them. When you get maybe 200,000 naira salary here, and you get to abroad, they are paying you about 2 million value of 2 million naira value. You have to just rethink it. That will you continue? Perhaps the funniest thing is that if you go America, go UK, see that we have a lot of Nigerians, and they still continue to open door, even in Saudi Arabia.
And they continue to welcome these health practitioners, right? Because they understand the value of these people more than the Nigerian government does.
Beyond that, studying health in Nigeria is quite cheap. Health-related courses. You can't go to Saudi, you can't go to UK or America that you want to become a medical doctor. You know how much you have to cough out to study. That's why you even hardly see Nigerians sending their children to study medical related. They will bring them down to Nigeria to study, then they will now move
to practice
because it is cheaper to study.
Now, one of the many concerns raised by these CMDs is that the Nigerian military, alongside the judiciary as well, is being favored more than the medical or the health sector in the country. How true is this? And
it appears so true. Right, because even remember what Wike just did. Yes. He was trying to build house for them. You recall that they also moved their salary percentage. You recall it was even approved before the minimum wage,
which was about 300%.
Right, 300% increase. So if you look at that, that means you are taking advantage. You are discouraging them in that. And I like that argument. I think they should push that argument further so that they can actually increase their salary and other benefits during. Because the joy of doing every, especially sensitive work at that, is to have a good income that can even take you home, take care of your children. So as a medical doctor, they also deserve a good salary. If the judiciary is in need of that, they should. And I want to also talk about their own medical association. They should push more for that better pay.
Now, how big a threat is this to our health sector? If you take a look at how the world continues to grapple with medical emergencies or epidemics or pandemics and all of that, yet we are seeing our own health practitioners leaving the country to other climes of the world to practice there. Should, in case we have, or in the case we have an emergency like the COVID-19 pandemic again in the country,
beyond COVID-19,
that's stressful.
Beyond COVID-19, the ratio of patients to doctor, it's just too much. Go to any general hospital or go to any hospital now, you discover that when you have the doctor you have, because I recall the last time we tried to go to government hospital, you'll be there and you'll be in a very long queue that you need to see doctor. Remember, they'll be calling you one after the other. So you can go there for 4 hours, you have not been, because that simply appeared to be shortage of a medical doctor. Sometimes you get there, they'll say medical doctor is attending to others. So I think that, and it's also encouraging them to have a private practice, because if your salary is not enough, you want to go and establish one hospital somewhere,
yes,
then you quickly go there, solve the problem before you, and that will be your first priority because you think that brings you
more money. Yeah.
So that's just the problem. So the ratio is just too poor, and we need to do more to have much more medical doctor and discourage people from actually traveling. But as individual, you want to think, you don't want to find reason to discourage them because they need a greener pasture.
They need greener pastures. everybody wants a better pay.
Life.
Everybody wants more bread on their table.
Right.
So, but let's also talk about how complicit some private medical centers are in taking away the attention of medical practitioners from public health, the public health sector to the private health sector, where a medical practitioner is employed by the state government or the federal government